Well, good evening, everybody. Welcome to Delaware Mini Medical School Early Fall Edition, which is being hosted with Bay Health. My name is Tim Gibbs with Delaware Health Force, part of the Delaware Academy of Medicine and Public Health. And I just realized we have new branding and I need to change that, but that's a task for another day. We are streaming live on YouTube at that address shown right there. And in a moment, I will drop the exact address for this particular stream into the chat. But if you go to YouTube/Delamed302 and go to live, it'll show up right there. Past presentations and recordings are at DelawareMiniMed.org. And we're doing this in partnership with the Sussex County Health Coalition, as you all know. Want to remind yet again that the Delaware Health Sciences Alliance and the DIMER program, Delaware Institute for Medical Education and Research, is doing a special event just for those of you who are interested in specifically being a physician. We'll also drop this URL into the chat so you can sign up for that if you're interested. Housekeeping tips, just to remind, this is a webinar, not a meeting. You can't see each other, we can't see you, but you can see us. Please use the Q&A feature, not the chat feature. We don't do raised hands except for our one exception who it can't be avoided. Just remember when we get to the Q&A, no questions of a personal or family nature. We're very concerned about patient privacy. All questions will be addressed, some by staff if they're housekeeping related. Others will be selected for direct answer by the presenter. And we do like to allow everyone to ask questions. So for those of you who are very inquisitive, we might not get to ask all of your questions. Finally, you do need to stay through the entire presentation, but when the Q&A starts, you are free to exit and you'll be counted as having attended. At this time, I'm going to turn it over to my colleague, Christy Handley with the Sussex County Health Coalition, who will introduce this evening's speaker. Christy.
Great, thanks, Tim. Just as a reminder to everyone, Sussex County Health Coalition for the month of October is going purple. So we would love for you to join us, and I will put the website in the chat as well so you guys can join us for Going Purple. And then we also have an event on November 14th at the Calvary Church in Dover, Delaware, where Carrie Bates, who is a 3-time Olympic gold medalist, will be joining us, as well as Tara Connor, who is a former Miss USA. And they will be talking to us about some recovery that they have experienced themselves. So we would love to have anyone come join us. This is a free event, and I will put all of that information into the chat for you. So now we're going to get on to introducing our speaker. So today we are lucky enough to have Staci Schmidt with us, who is a nurse practitioner who specializes in gastroenterology at Bay Health, which is a branch of medicine that deals with the stomach, the intestines, and all those important things that help your body digest all your food and absorb any of those nutrients. So basically, she likes to say that she helps people feel better when their tummies aren't working quite right. So I'm going to turn it over to Staci. Welcome.
Hi, thank you so much for having me. I'm going to go ahead and share my screen. I'm going to make sure that it's working.
There you go.
It's the wrong one. Hold on. Of course. Oh. Wait 1 second. Sorry. Okay, can everybody see my screen? Give me a thumbs up.
You're good.
All right, thank you so much. Okay, so thank you for the introduction. I really appreciate that. This is my presentation on Gross But Cool, Adventures in Gastroenterology. So I am a nurse practitioner in gastroenterology. And as she mentioned, it's the study of the stomach and the intestines, the liver, the pancreas, all of those fun things. So I actually have a background in nursing and endoscopy. So I had my undergraduate degree in biology and anthropology in a minor with chemistry a long time ago. And that was actually meant to be a pre-med. But I didn't go to medical school. I was really into rowing at the time, and I spent a bunch of time doing that and was more devoted to rowing than I was to school. So over the course of time, I got through that, kind of did as much with the rowing as I wanted to do. And so I actually went back to school to be a nurse. And it took an additional 2 years-ish in addition to my undergraduate to get my nursing degree. And I started working in the ER. I worked in the ER for 3 years. While I was working there, I got my bachelor's degree in nursing. And then I went back and got my nurse practitioner degree, which is a master's degree, just last year. So I actually just graduated in May. In that time, I was working as an endoscopy nurse, which we're going to go over endoscopy in just a few minutes, but it's essentially using a scope to take a look inside the digestive system. And I love educating the patients. I think that's one of the biggest roles that I have. And we'll talk about, constipation and how to relieve and make your bowel movements better. And I spend a lot of my day doing that. So, quick question and throw it in the chat. What is your favorite food? We're going to kind of follow the digestive system here. If you want to throw it in the chat, we'll kind of chat about it as we go. All right. So what is gastroenterology? So Christy went over it very briefly. It is a branch of medicine focused on the digestive system, including the stomach, the intestines, liver, pancreas, and more. And just a fun fact, the digestive system is about 30 feet long, so very long. And we're going to kind of go through it step by step, go over the anatomy. So it starts with your mouth. I asked my 11-year-old where the digestive system starts yesterday, and she said the esophagus. I was like, so close, but we have to start with the mouth, right? This is where a lot of the mechanical breakdown is of your food, chewing. Okay. Now also it mixes with saliva, and saliva has enzymes in it that start the digestive process. It is important in breaking down mostly carbohydrates. So then let's see, once you swallow, you create a little ball of food. It's called a bolus. And it moves into the esophagus. Okay, the esophagus is a tube that goes from your mouth into your stomach. You have a little bit on the left here. You have a little diagram. And the way that it works is it pushes food down in a wave-like motion called peristalsis. So you have muscles contracting here that push the food down the esophagus. On the right-hand side there, you can see an X-ray, and this is what's called a barium swallow. This person has swallowed contrasts, which makes it show up nice and bright on the X-ray. But you can see where that yellow ring is. That is what we call a stricture, okay? And that's where, for some reason, that barium is having a hard time passing. So this person would come to me probably with complaints of, I can't seem to swallow. When I swallow, something it tends to get stuck. It has that slow, can't quite pass it feeling. And so this is one of the studies that we could do to take a look and see exactly what's going on there. And some people have just a little dysmotility where the muscles aren't working quite right in this case. All right, so once we get through the esophagus, we get to the stomach. Okay, the stomach acts like a blender. Okay, so you've done the initial breakdown of food with as you chew, right? And it started the breakdown of carbohydrates with your saliva. And as it gets into your stomach, we add hydrochloric acid, very strong acid. And your stomach has all these layers of muscle. And so it's a very muscular organ, and it turns it into something called chyme, C-H-Y-M-E. And it churns and churns and churns. It uses all those muscles to break down the food even more mechanically, as well as with the stomach acid. So, fun fact, stomach acid is strong enough to dissolve metal. Now, the reality is if you swallow something metal, it's probably going to keep passing down. So you're probably not going to stay there long enough for it to digest. But we have actually had children come in with it embedded in the wall of their stomach because the stomach acid has eaten underneath it to irritate the lining of the stomach. And that being said, the lining on the inside of the stomach is very strong, and it is meant to withstand that acid. So once we create a wonderful juicy mix of chyme, we're going to move, and once it reaches a certain pH, then that chyme will move down here into the small intestine. Okay, so the small intestine is really, wrong way. Previous. The small intestine is really long. It's all coiled up in there. It about 20 feet long. Well, you're shorter than 20 feet, right? But it's all coiled up. And so with all that coiling, it fits. It's a small tube because it's all liquid that's coming out of your stomach, okay? And it is the part of the digestive system that absorbs the most nutrients. It is absorbing all the proteins, all the vitamins that you eat, all the fats that you eat. All of those things are getting absorbed in the small intestine. And one of the ways that it does that is by having a really high surface area. So on the slide here, it shows little villi, okay? And villi are these little projections. They look like fingers. And on those are what are called microvilli, which are even smaller. And what that does is it increases the surface area. So a really good example of increasing surface area is if you talk about, say, cooking a potato. If you cook a whole potato versus you cook a potato that's been cut up, which one is going to cook faster? It's going to be the one that's cut up, right? And that's because it has more surface area. It's the same size potato, but it has more area that's in contact with the hot water, and so it cooks faster. Okay, so the villi, you've got a flat small intestine, right? But if you create all these little micro projections, then it increases the surface area and allows you to absorb more nutrients. So after the small intestine, it keeps traveling through. You've absorbed everything that you possibly could, besides maybe some water, okay? It's still very liquidy. Then it moves into the large intestine. Okay. The large intestine is where we absorb most of our water back. So it starts, your small intestine comes down, squiggle, 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 and then it joins right here. It's called the ileocecal valve, and it joins into the cecum of this large intestine. And at this point, it is liquid stool, okay? It's as if you had a really bad GI bug, and if it's all liquid coming out, that's what it looks like when it gets to this point, okay? Then hold on just a second, I'm sorry.
And just real quickly, folks, did want to acknowledge the chat is in fact turned off. So when there are the little quizzes, either we'll use the polling feature or you can drop it into your response into the Q&A. Thanks.
Sorry about that. Oh, of course, the 5-year-old who needed something. Okay, so sorry about that. Okay, so your liquid stool is coming into the right side of your colon here at the cecum. And as it travels throughout the colon, it gets the water absorbed out of it to create a solid stool by the time you get to the left side here. Okay. Throughout your digestive system, there is a lot of bacteria. It's in the small intestine, but there's a lot in your large intestine too, and it helps with digestion, breaking down like the higher fiber foods and actually helping synthesize vitamins, make vitamins out of your food. So, and that's where it forms poop. So, that's where we get to the fun part of the presentation where we get to talk about poop. So this is called the Bristol Stool Scale. And one of the questions that I got from my 11-year-old yesterday is, what is constipation? And constipation is pretty much one of these top two, okay? It's type 1, type 2. It's when you are pooping little pebbles. It might look like little rabbit poops. Type 3 and type 4 are considered to be kind of the normal. That's kind of where we aim for, but type 5 is okay too. Once we get down to the type 6 and type 7, that's when we're concerned about like malabsorption, people that can't absorb nutrients well from their food for some reason, people that are really sick, that kind of thing. Okay. So, this is always, this is a good chart to kind of take a look at, because if you're routinely in the type 1, type 2, there's something that we can do to optimize your bowel movements, as we say, to make sure that you're getting fiber and water and all of those things, to make sure that you're having good stools rather than hard little pebbles that are hard to push out. Okay, so next we're going to talk about the color of your stool. All right. So this is kind of fun because your stool can tell you a lot about how well you are doing, right? And you can kind of see that from the prior slide as well. People that are maybe a little dehydrated are going to be more constipated. People that are sick are going to have diarrhea, right? So we can look at that in this regard too, is by the colors of your stool. So let's see. Green. Green is actually a pretty common color for stool to be. Mostly it's brown, and that's great, but occasionally it's green. Occasionally it will be a sign of a liver problem or diarrhea. Red is always concerning. Okay, if you've eaten some beets, we can let it slide. It's good. But anytime you have frank redness, then we need to talk about maybe is there some blood in the stool, and it's usually from the lower part of the intestines. So either, I don't know if you guys have heard of hemorrhoids, that's where there's a vascularity at the rectum, right where your poop comes out, and that can bleed if they're really irritated. So that would be a sign that there's something going on for sure. Yellow, maybe you ate too much fat, or there's problem, again, absorbing nutrients. An example would be celiac disease, but Crohn's, inflammatory bowel disease of some kind might be the reason for that. White or light colored stools, again, probably fat. Sometimes it's an issue with the gallbladder or the liver. So the other thing about having a lot of fat is it also might float. Just like oil floats on top of water, it's the same thing. If you have a lot of fat in your stool, it will also float. So that's also something that happens with malabsorption, people that aren't absorbing things well. Again, brown, fabulous. We're good with brown. Black. Black it can be concerning. Again, if you ate licorice, okay, we can take that. But sometimes if people are on iron supplements, it will be black. If they've taken Pepto-Bismol, if they've had an upset stomach, it might be black. But it can signify bleeding in the upper part of the digestive system. So if the stomach is bleeding, if the esophagus is bleeding, it can actually, once that blood digests and it travels through the entire digestive system, it turns black. So, another fun fact, gum does not stay in your stomach for 7 years. Again, if it can dissolve metal, it can probably dissolve gum. But again, it probably passes pretty quickly. You make 1 to 2 quarts of saliva every day. And this is a funny one. And the longest recorded poop is 26 feet long. Okay, fact check. That's not true. It was a hoax. Somebody claimed that they had a 26-foot long poop, but it wasn't true. Your colon is only 6 feet long. So anybody with longer than 6-foot poop is, nope, I'm calling it that it's a hoax. So, okay. Next up, we're going to kind of talk about what we can do to help people if you have, say, some red or some malabsorption issues, something like that. We can actually take a look inside, and that's what endoscopy is. We kind of touched on it briefly. Oh, I forgot. We gotta touch on the pancreas. Okay, so the pancreas is an accessory organ to the digestive system. It has 2 main functions. It has an endocrine function, which is the function that it secretes hormones to help control your blood sugar. So if you know someone that is diabetic, they may have trouble creating insulin and it makes their blood sugar go really high. Or if they might have to inject insulin to help them. Glucagon acts in the other direction. So glucagon would lower your blood sugar, whereas glucagon raises your blood sugar. It mobilizes sugar from your liver if your blood sugar is starting to run low. Insulin allows your body to utilize the sugar. So yeah, it's very complex. I'm trying to simplify it a little bit, but the other function of the pancreas is that it secretes digestive enzymes into the small intestine. So where all those little villi were, it puts digestive enzymes directly into the small intestine and that helps break things down even further so that it can be absorbed. All right, so next up, the liver. So the liver, it's in the upper right of the abdomen, okay, right kind of beneath the diaphragm, on top of the stomach. It's about the size of a football, and it's like kind of a reddish brown. Let's see here. And the liver function, this is a lot of words, but in short, the liver has so many functions. And it acts to filter the blood. So the nutrients that are absorbed from the digestive system go directly to the liver to be filtered, and then it gets circulated around the body. And it also removes any toxins and byproducts of medications or foods, anything toxic in your body. It processes nutrients, again, going back to that glycogen and your blood sugar control. It can store glycogen, and it helps also control your blood sugars. Metabolism, carbohydrate, fat, and protein metabolism. It produces bile, which is, it helps digest fat. So bile breaks down the fat and makes it so that your body can absorb it. Protein synthesis, so as proteins are broken down and absorbed into the body, then your liver can take it and turn it into the kind of protein that you need. Waste removal. It metabolizes waste products like your old blood cells and converts them into substances that can be excreted in the stool. And then vitamin and mineral storage. So the liver has quite a bit of fat in it, and so it stores those vitamins and minerals that are fat soluble. So lots of information on that slide. I was having a hard time cutting that back at all. Okay, so now we're going to talk about the tools that we use in GI. So I told you that I worked in endoscopy. So this is where we use that thin camera to take a look in the digestive system. And we can do it one of two ways. We can take a look down in the mouth, down the throat, into the stomach and the small intestine. Or if you've had a really good clean out of your colon, we can go up in your colon, take a look, and we can actually make it all the way to the small intestine the other direction, and take a look for, mostly we're looking for polyps, especially in the colon. The endoscopy, the upper scope, we're typically doing it for diagnostic reasons, right? We're not just screening for cancer or anything like that. We're looking in there if a patient has trouble swallowing, reflux, so acid coming up in their throat a lot, just belly pain, just don't feel well, nausea and vomiting, any of those things, we can go down, take a look, see if there's any abnormalities in the esophagus or in the stomach. As far as colonoscopy goes, we can do the same thing. We can do it for diagnostic purposes, but mostly we're doing it as a screening for colon cancer. So polyps are teeny tiny little growths. I usually correlate them to like the moles on your skin, right? They're teeny tiny and usually they're no big deal. But occasionally they can turn into cancer if they're left to go too long. So we go in there with the scope and we look for teeny tiny little polyps. And these pictures along the bottom here are kind of what it looks like within a cleaned out colon. This is a really, really good clean out. Usually there's a little bit of debris in there, but for the most part, we're looking, and the little polyps are just itty bitty. They look like this. They kind of pop out of the side wall of the colon. So, and then what we do is we take this nurse is assisting the doctor who's got the scope there. The doctor has this down in the, it looks like in the throat. I don't know, but, and then the nurse has this long cable attached to a handle, and she is taking biopsies of the polyps that are in there. So you can kind of see on the screen, he's looking and he can see the end and where that nurse is controlling the tool. So he'll ask the nurse, can you open the forceps? Can you close them, open them, close them? And they can take biopsies that way because he's busy driving the scope. So in that case, we can take out polyps when they're really little and before they become cancerous. So it's one of the reasons why your parents might be getting colonoscopies. And once you have a few, then we tend to go back more frequently to double check that you aren't growing more of them. So if your parents are over 45, they need to have their colonoscopy. Okay, so let's talk about kind of ways to stay healthy as far as the digestive system, and again, optimizing your stool, right? Your poop. We really want to see fiber-rich foods, fruits, vegetables, whole grains, that will help you have, on that Bristol stool scale, we want that to 3, 4, 5, right? So lots of fruits, veggies, whole grains will keep your stool soft, prevent hard stools, but also staying hydrated is a big thing, and moving your body. And that's however you want to move your body, whether it's dancing or gymnastics or walking the dog, whatever it is, we like to see you moving your body so that you can have good bowel movements and manage stress. So, all right, moving along. We're gonna play a little game. I'm gonna pull up oh, hold on. Go back. Sorry. Let me pull up the Q&A. Is there a way for me to do that? I can't find it.
Should be at the very bottom of the screen. And it says
Oh, there it is.
Q&A.
There it is.
There you
I found
go.
it. Okay, perfect. Okay, so we'll come back to some of these questions that are in here. But in the meantime, okay, we're going to do which food has more fiber. Okay, so let's see. An apple versus potato chips. Which one has more fiber? Go ahead and put it in the Q&A. What you got? Apples, apples, yes, absolutely, apples, 100%. Apples with the peel, I like that. That was a good answer. Because if you take the peel out, it's just not as high fiber. So good job there. Good. Okay. So the next one, brown rice versus white bread. Which one has more fiber? Yes, brown rice. Good deal. Good. Everybody's getting it right. Very nice. Okay, this one's a little trickier. Nuts or beans? Which one has more fiber? Beans, beans, beans. I'm seeing a lot of beans. It's a trick question. They're both really, really good fiber choices. So all of those things are great for you. Making sure you're staying hydrated, move your body, manage your stress. All of those things will help you really have healthy digestive systems. Okay. All right. So let's see. Careers in gastroenterology. So I wanted to touch on this very briefly. I am a nurse practitioner. I see patients in the clinic. I address any digestive issues that they're concerned about. So if they're having diarrhea, if they're having constipation, belly pain, reflux, any of those things, I have a lot of tools in my toolbox that I can treat patients, and we do spend some time doing some diagnostic work, and I can treat those complaints. And then I often send them to the GI doctor who can do the scoping. So I will put in a request, and the doctor goes in, does whichever scope that I need them to do, and then they send me those results back so that I know how to treat my patient. The nurses and the technicians, they usually are prepping and recovering the patients from their colonoscopy or endoscopy. The technician is the one that is actually using the biopsy forceps, right? Assisting the doctor with the procedure itself. And then we work closely with dietitians because a lot of the issues that we come across are related to what people are eating. And especially if there's someone that needs a lot of restriction. So if they have an allergy to dairy, then we can send them to a dietitian that will help them make sure that they're getting the nutrients they need while still keeping the dairy out of the diet. So teamwork, I mean, it's key to making it possible to care for all these GI patients. Let's see. So just to recap, from your first bite to your belly, to your intestines, and out in your poop, your gut's amazing. It is amazing all the time. I learn something new every day. The food is what fuels your body, and you have to take care of your gut because in the long run you can have a lot of issues, right? If we're not, right? If you have constipation all the time, or if you're diabetic because you haven't been taking care of yourself, then you know, we gotta eat healthy foods and take care of our body. So, quick quiz. Okay, we're gonna use that Q&A again. Oh, look at that. Thank you for the survey. All right. So, which organ acts like a blender with acid? Where are most nutrients absorbed? And what tool lets doctors see inside the stomach? So go ahead and put in your answers.
And you've got a fourth question.
Oh, there is? Oh, yeah, there is. Oh, what colors can your stool be? Love it. I feel like I need the theme song from na 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 na. Jeopardy. That's the one I was looking for.
All right, it looks like 97% of the people have answered.
Oh, wow.
Give it
Nice.
about
Okay.
10 more seconds. And we're going to end the poll.
Okay, so let's see here. So we've got which organ acts like a blender with acid? Stomach, 90%. Very nice. Where are most nutrients absorbed? Yes, small intestine. And what tool lets doctors see inside the stomach? The endoscope. Good. And what colors can your stool be? Any and all. Okay, good job. Thank you. That was great. All right. So thank you so much for having me. It's been a really interesting thing. Let's go through some of these questions though, okay? All right. So why do your turds split when you have constipation? So your turds split because all the moisture is drawn out of it. Your body's trying to pull all the moisture out of the stool. So it's kind of like when mud dries, it can crack, right? It's the same kind of idea. Let's see. How does urine and stool separate in the digestive system? Okay, so your urinary system is a completely different system than your digestive system. So urine is created in the kidneys and it filters your blood and it draws the draws any extra fluid and any extra electrolytes out of the urine or out of the blood, and then it drains down skinny tubes. So actually your kidneys are in your back, and it drains down the skinny tubes into your bladder, and then that comes out your urethra. So hope that answered that question. If someone has insulin resistance, does that mean that their pancreas isn't working properly? So insulin resistance is more along the lines of your body not being able to use the insulin to pull the sugar into the muscles and into the tissues that need the sugar. So so the pancreas actually at that point creates lots of extra insulin to try and outpace it, right? To try and keep up and allow your body to absorb the sugar. And then it actually in the long run can make it worse because then your pancreas becomes kind of burnt out because it's creating so much insulin. So it's kind of a slippery slope at that point. How does fatty liver disease develop? And what are some digestive complications from having the gallbladder removed? Okay, so I'm going to start with the gallbladder removed first because it's a little bit simpler question. When your gallbladder is removed, the gallbladder stores bile, which is the fluid that helps break down fats. and absorb fats. So a lot of times if people have had their gallbladder out, they will actually end up with diarrhea because if they eat a really high fat meal, and it's because they're not absorbing the fat the way that they should be. The other question was, how does fatty liver develop? And fatty liver develops from a number of different things. It can be caused by so many things, but it can be caused by excessive alcohol drinking. It can be caused by high fat diet and obesity. It can be caused by uncontrolled blood sugars. Yeah, there's a whole slew. Infection, hepatitis can cause it. There's many things that can cause a fatty liver. Let's see. Okay, what causes polyps? Are there different kinds? Would this lead to constipation? Okay, so what causes polyps? We don't know. The short answer. There is some correlation of people that eat red meat tend to have more polyps, but it's not necessarily, correlation versus causation, right? People that eat less red meat may also be eating more fruits and vegetables, right? So we don't know what is really causing the polyps. A lot of it is hereditary. We do know that. There's a, yeah, there's a lot of factors that go into polyps, but a lot of it is hereditary. I think I missed the third part of that question, but that's okay. We can go back to it. You can re-ask it. What causes diarrhea when you're under stress? So there is a known entity of your brain and your gut being very closely connected. And so any kind of stress can cause either constipation or diarrhea, and it just depends on your body. And I had a really good example, or I read a really good book that was talking about how your digestive system is its own ecosystem. It has its own animals, it has its own flora in there and fauna, it has its own like bacteria. And so sometimes you have to kind of see what works best for your ecosystem. So what works for my ecosystem is not going to be the same that works for your ecosystem, if that makes sense. So sometimes you got to kind of play with what works well for you and what doesn't. Let's see. Does burping have anything to do with the digestive system? Yes, absolutely. So there's kind of there's two forms of burping. There's the esophageal burping, which is kind of the kind that's intentional. People learn it. And it's the one where you like swallow air and then you burp it back up. And then there's actual burping that's uncontrolled. So you can hear the bubbling coming up, and that's from the stomach. And I think the other part of that question was food poisoning. Something about why does food poisoning cause diarrhea?
Yes, it was about food poisoning.
So food poisoning causes diarrhea because your body is defending itself. It says there's something not right in whatever this is, and we need to get it out. And so, yeah, so it just flushes everything out. Most important thing to do is stay hydrated in that case. How does your stool turn different colors? Well, that depends on what you're eating primarily. Again, if you have some blood or if you're not digesting things well, that's one thing. I've noticed that artificial dyes tend to dye the stool a little bit more than like natural foods. Yeah, but any food can affect it because the dyes make their way down through. What can cause heartburn? So heartburn can be caused by a few things. One of the big factors is caffeine ingestion, alcohol ingestion, spicy foods, that kind of thing. And sometimes when people are a little bit heavier, their abdominal like fat can push their stomach up past their diaphragm a little bit and create what's called a hiatal hernia, where part of your stomach is hanging out in your chest. And that tends to be a big cause of reflux as well. But sometimes it's just what you eat. And some people just naturally create more stomach acid. So let's see here. How to know if blood is from hemorrhoids or somewhere else. So bleeding from hemorrhoids is generally bright red, and it's usually coating the stool, the poop, and it's usually on the toilet paper. If it's bleeding from somewhere else, that is generally a it's like it's partially digested, so it'll have clots in it. It will have it'll be black instead, that kind of thing. If food is such a major factor in gut health, why are more people not informed of what's healthy and what's not? That's a very good question. And that was, a lot of it is cultural, right? A lot of it is what your parents teach you to eat. Yeah, unfortunately, our culture is so set on, fast foods and things like that, highly processed foods, and all of it can be rough on your digestive system. All of the natural foods that we eat, fruits, veggies, whole grains, those can be are much better. So, can you explain something called diverticulitis? Okay, so I have to start by explaining what diverticulosis is. So when you have the walls of the colon like this, as people age, they can get something called diverticulosis, which is these little out pockets. It's like a weakening in the side wall of the colon, and they pop out like this, okay? And they create a little pocket here. It looks almost like when you're going down the colon with your endoscope, it almost looks like Swiss cheese. There can be so many diverticulum, okay? And those little pockets, if they get inflamed or infected, that's what's called diverticulitis. We usually have to treat it with antibiotics. Sometimes if it's really severe and they rupture, then you can end up with surgery, that kind of thing. But for the most part, uncomplicated diverticulitis can be treated with some antibiotics. Okay, so can fatty liver disease turn into cirrhosis of the liver? The short answer is yes, it can. Sorry, my interruptions. Okay, so can fatty liver turn into cirrhosis? Yes, in the long run it can. It's kind of a spectrum. So at one end you have a very healthy young liver with no damage to it, and at the other end you have cirrhosis. Okay, and it goes healthy liver, fatty liver, fibrotic liver, then into cirrhosis. So it's a long drawn out spectrum of liver disease. And at any point, it can go back. It can be kind of repaired as long as it's not too far. I mean, there are people that need liver transplants, but for the most part, if we stop assaulting the liver with either alcohol or fatty foods or whatever it might be, then we can move back the other direction. Hope that answered that question. How does moving the body help digestion? So, anybody been on a run and had to go to the bathroom when you're done? It's the same kind of idea. So just moving and walking and it helps everything move through the digestive system. All right, how does jaundice affect your digestive system, if it does? So jaundice is generally, it's where you have a buildup of it's where the liver isn't working quite properly. So what happens when we break down red blood cells, it breaks down into different parts, and one of them is bilirubin, which causes your skin to turn that yellow jaundice color. So really, when we see someone that's jaundice, we're more concerned about, is there something going on with their liver? Not necessarily if it's affecting their digestive system. Although there's exceptions to that, like when you get down to the cirrhosis kind of point. Okay. Does your digestive system grow as you do? Absolutely. Absolutely, yes. How do probiotics work? If they're dried and put into a capsule, how do they become reconstituted? So your body reconstitutes it, puts it in when you put it in your stomach, that pill is going to absorb moisture from your stomach. How probiotics work, it's a little bit tricky because the digestive system has all those bacteria in it, but they tend to be in what's called a biofilm. So you know that pink scum that's in your shower? That's called biofilm, and it's kind of a thing that protects itself. So unless you scrub it off and hit it with some bleach, it will continue to go back, right? It will continue to be there. So if you have kind of a biofilm like that in your digestive system, in your small bowel, and what they've found is that probiotics are great if they work well for you, but they will only work if you're actively taking them, because your biofilm doesn't actually change. It's just in that moment, the probiotics are working. Valerie, go ahead. Do you have a question? Hold on.
She's the one with the gesture recognition that we can't turn off.
Oh, gotcha. I thought her name sounded familiar. Okay, great. Okay, let's see. Is there certain foods that cause reflux, or are there other factors as well? So it's not necessary. Again, it's your own ecosystem. So whether or not it affects, some foods make some people have reflux. So a lot of people have spicy foods. Tomato sauce seems to be a big one. Caffeine, again, tends to be a big one that causes reflux. Let's see. Other than increased cases of diabetes, how does chocolate candy go through the system? So it's going to be the same process. So in the mouth, the carbohydrates are going to be broken down. That travels through your esophagus into your stomach, where the acid is going to physically break down all the fats and the proteins. And then in the small intestine, you have the pancreas and the gallbladder mixing it all together and breaking down and actually breaking down the proteins and the fats. And then it can be absorbed into the body. Hope that answered that question. Okay. What about babies and the color of their poo? Oh, babies are fun. Okay. So when a baby is first born, it has black tarry stool, like we talk about that we don't want to see in adults, right? Because if it's black stool, that means it's a bleed in the upper part of the digestive system. We would not want to see that in an adult, right? But in an infant, it's okay. And that's because that baby has been swallowing amniotic fluid for the entire time that it's been in its mother's womb, right? And all of that, when it gets pooped out, it's very dark and tarry. And I don't really know the mechanism behind it, but other than that. Now, as far as like when they're a little older and they're breastfed, it's usually yellow and what's considered like seedy, and that is normal for them. Again, if you had like a solid stool from an infant, that might not be as good. That might actually be constipation for them. Let's see. How does one get diverticulitis? So, usually it's something getting caught in one of those little out pockets and it getting inflamed and infected. So, will diverticulitis always be a concern for a person who gets it? Okay, so diverticulitis can be prevented by having a high fiber diet to keep things moving by all those little diverticulum, right? Because if you have a lot of constipation and it backs up into those little pockets, then that's when it gets inflamed and infected. So again, with your own microbiome. Sometimes it's having some probiotics in there helps. Sometimes having some fiber in there helps. But overall, it can continue to be a concern if someone is getting it over and over and over again. Then we might consider doing surgery to remove part of their colon. But that's kind of a last resort. If we can treat it with antibiotics, that's a much better approach. Let's see, how does it work when your gut health problems show up in your skin? So a lot of allergens, I think, turn up on as skin. Like if a lot of people with dairy intolerances may have kind of an eczema, or a lot of eczema tends to be some kind of allergic reaction. And generally there's some GI, some digestive system issues that go along with it. Can diverticulitis be healed? Yes, absolutely. So kind of, as I answered earlier, the antibiotics are the big one. If it's a recurrent thing that's happening over and over and over, then we could do surgery to remove that part of the bowel. So I think that's about it. Anybody have any other questions?
I do.
Sure, what you got?
If you don't mind fielding, going back to colonoscopies and the question about polyps, can you tell us about the different types of polyps that there are? Because there is more than just one type.
Right. So there's three main classes of polyps. There is hyperplastic, which is pretty benign. You don't even have to take them out. There's a tubular adenoma, which is the big one that we look for as far as its prevalence. So lots of people have tubular adenomas. They can turn into colon cancer. So those are the ones that we're pretty much most concerned about in a screening colonoscopy. There's a third kind, a sessile serrated polyp, which it can also be concerning as well, but they're not as frequent. They're a lot lower in the likelihood of those happening. The tubular adenomas are the ones that we're really, really looking for in those screening colonoscopies. Let's see, and Cassandra asked, when getting labs drawn for your liver, what numbers reflect that area? So there's a few different things, and it depends on the lab. So they're typically ALT, AST, and bilirubin are the big ones that we're looking at. And the lab should give you a reference number that lets you know if you're within the range. It's because if you're because it depends on the lab, and sometimes it can be like if you're 1 over, then it will be considered abnormal, but really there's a little bit of error in those numbers too. So you have to look at your lab and see kind of what they consider normal. What is considered a high fiber diet? Because I know someone who had diverticulitis and they were told not to consume too much fiber or consume food high in fiber. So for instance, they could not consume spinach and lettuce. That's surprising that they suggested that, because usually we do say, now, it used to be back in the day, they used to say no nuts or seeds because they felt like those got caught in those little pockets and then they would end up infected and inflamed. But what they found is that the evidence shows that that's not the case, that the higher the fiber, the better we are at moving things by. So for women, they recommend 25 grams of fiber, and for men, they recommend 30 grams of fiber. And it's a lot of fiber. If you actually add up how much fiber you're having every day, it is not even close to that, I can guarantee it. So that's why a lot of people add a fiber supplement. What was that question?
Translate that into food that we would eat, like how many apples or how many spoons of
So I think an apple, I don't remember exactly the numbers. But like a serving of prunes is only like 5 grams of fiber. It's much less than what you would expect. So the next time you're looking at whatever you're eating, look at that nutrition label and see what it says. Because there is significantly less than most people think. Let's see. Will they ever make the prep for a colonoscopy more pleasant and less time consuming? Oh no, absolutely not. So, the prep, for those of you that don't know what the prep is like, it's a diuretic. It makes you have, I mean, not a diuretic. It's a laxative, makes you poop and poop and poop until everything coming out is clear. And that will probably never improve because the polyps that we're looking for are so tiny. 2 to 3 millimeters is all they are. And so if you think about the amount of stool that you need to get out and you have to clean all of that out, that's a big project no matter who you are. So the prep will probably never get any better. Sorry.
Well, Staci, thank you very much for, it wasn't that gross. And we had people saying thank you. This was the most interesting class so far. So you scored there. Just wanted to remind everybody that next week we're going to be talking with social workers, superheroes without capes. And I also wanted to let you all know that the next series, the late fall series, starts on November the 5th. And that'll be going up on the website soon. And Staci, I see that your daughter is there in back of you saying hello to everybody.
You say hi.
And see y'all next week. Thank you.
Thank
Bye-bye.
you. Bye.